Episode 29. This is the Inside Deschutes County podcast. It's available everywhere. Subscribe on any podcast platform. You can also find us on deschutes.org/podcast.
Deschutes County is an amazing place to live.
Ease of access.
Work and play.
Great place to raise a family.
I love the weather and the high desert.
At Deschutes County, we provide excellent service.
We're here to help you.
Deschutes County is the heart of Oregon.
Everyone wants to be here.
This is episode 29 of the Inside Deschutes County podcast. We're giving you all the news, in-depth interviews, hot topics from all around the county. We're bringing you this podcast from the Deschutes Services Building in beautiful downtown Bend, Oregon, just in case you're listening from afar. Thank you so much for listening. I'm Eric Brion. Well, we hope you're enjoying spring so far. Bring on the hot weather, I say. Let's go. Come on. Last episode, we talked to Fair and Expo. We're about 60 days away from the Fair and Rodeo. That's a hot weather event. We gave director Jeff Hines a hard time about not announcing the fair concerts on this podcast. Probably understandable on his part. But they just announced The Fray will kick off the concert series there. That's big news. Congrats to them. More announcements to come. You can follow their social media channels for all the official fair announcements. But on this episode, we have big things coming to health services. There's always big things at health services. My guest today is Christine Pagano, Supervisor for the Women, Infants, and Children program, also known as WIC. Christine, thank you for joining us.
Yeah, thanks for having me. Happy to be here.
First off, you a fan of The Fray?
No, I don't know who they
90s
are,
band?
really.
90s? I think it's 90s.
Maybe ringing some bells, but I
definitely not
couldn't sing a
80s.
song.
I'd have to wiki it or YouTube it or
Yeah.
whatever else people do. What about Young Gravy? Young Gravy's also coming to the fair. Any idea?
None. Nope.
Yeah. No clue. But I've heard like country rapper.
Okay.
Country, like a big TikTok guy. Is what I've heard. I could be completely wrong about this.
Have to check it out.
Young Gravy. It's his Grits and Gravy tour.
Seriously.
It is. I found that out too. See? You did not know that when you were coming to this podcast that you were going to learn about Grits and Gravy and
now
talk about The Fray.
Coming to Central Oregon.
I know. Big things happening at Fair and Expo. Christine, WIC, Women, Infants, and Children. We'll certainly talk about that in a moment, but why don't you tell me a little bit about you, just a little bit, Supervisor. How long you been here? What do you do?
Yeah.
And we'll get into WIC.
Sure. So I'm a supervisor with Deschutes County Health Services for the WIC program. Most people know what WIC is. It's been around a long time.
Not Wiki.
Not Wiki, no. The WIC program.
Do you have a Wiki page? Does WIC have a Wiki page?
I'm sure.
You need
yes,
one.
It exists.
WIC
I'm
needs
confident.
a
I've
Wiki
never
page.
looked at it, but I'm confident it is there.
We got to get there.
So I've been working with WIC for 9 years now. Not all with Deschutes County. I was a coordinator in Warm Springs for several years. I worked in Anchorage. I was a coordinator for the Anchorage Health Department for several years.
Wow, Alaska.
Yeah, loved it there.
That's big.
Yeah.
Big state.
Yes. So I'm a registered dietitian. That's what brought me into WIC. I'm also the mom of a 4-year-old, so
Nice.
yeah, helping parents
Boy or
with
girl?
their little kids. A little girl,
Oh, girl.
Penny.
Penny. That's awesome.
Yeah.
We'll have to get Penny on the program. See if she becomes a friend of the program. She listen to podcasts yet?
She actually listens to audiobooks to
Oh,
go to
nice. See,
sleep and like traveling. She's a big fan of audio entertainment.
I'm telling you.
Yeah.
The podcasts, the audio, it's big with the kids. All right, well, let's dive into WIC a little bit. But first of all, WIC is celebrating an anniversary
Yeah.
this year, this week, this month. What is
This year.
50.
Yeah. 50 years of WIC.
That's big.
I know.
1974.
74.
Okay.
Started in Kentucky. And here we are now.
I had no clue. Kentucky?
Yeah.
Well, it's a federal program, right?
Yep.
Okay, so this is, okay, but let's get back to the celebration because that's kind of fun.
Yeah.
There's going to be a celebration at Health Services. Talk to me a little bit about that.
Yeah, so June 6th, Thursday, next week, we're having a big celebration. We're going to have a bunch of community partners joining us. We're going to have many of the retirees from WIC. So
cool.
We have not only our WIC staff coming to help with the celebration, but we have a lot of retirees, people who've retired from WIC that are going to be coming and helping us. So we're going to have giveaways and fun games for kids. One of the biggest draws for the event is we're going to be giving out our farmers market coupons to WIC participants.
Coupons or coupons?
Definitely coupons.
Coupons. See, I'm a coupons guy. This is a big debate.
We can call them vouchers, I guess.
Okay, vouchers. All right, it's vouchers. Don't want to start any controversies. I've had enough of that on this program. Well, that's cool. So you're giving those away?
Yep. So we'll be
Okay.
giving those away.
And it's not just WIC that's going to be there.
Nope. We're going to have Neighbor Impact, Mountain Star, Mosaic Medical. There's going to be several other programs from Deschutes County Health Services going to be tabling. OSU Extension is going to be there doing a food demo. Advantage
on.
Dental is going to be doing some, what's it called? Dental screening. So
Okay.
looking inside your mouth,
Okay.
seeing if you got any cavities or whatnot. So we're going to
right.
have a lot of things going on. And yeah, we're taking over like part of the parking lot at Courtney at the Health Services building.
2577 Courtney.
Thank you. Yes, that's the address.
The address, in case anybody wants to know. June 6th.
June 6th from 2 to
Can they
4.
get more information where on your Facebook page? What?
Yeah, so Deschutes County WIC Facebook page or the Deschutes County Facebook page are the place to go to get the information about where, when, and what, all those things.
Well, perfect. All right, well, let's talk about WIC. I mean, that's kind of why you came here.
Yeah.
Okay.
What do you want to know?
Well, I want to know, I mean, women, infants, and children, how does your program help? Because I imagine is it nutrition? It's a big part of the program, right? So, but maybe you can explain to me a little bit more because I don't know the ins and outs.
Yeah, I think what WIC is most known for is the supplemental foods that we provide. When people think about WIC, they think about the milk and cheese and fruits and vegetables and beans and peanut butter that we give to our participants. But there is a lot more that goes on in WIC. So we also do a lot of nutrition education. So you can have all the healthy foods for your kiddo, but are they going to eat it? What? Feeding a 4-year-old, feeding a 2-year-old,
Let's ask
it's a
Penny.
lot more.
We've gotta ask Penny.
Yeah. It's a lot more than just, putting a vegetable in front of them. So WIC, we're really good at child feeding, infant feeding, and helping families with all of those challenges.
So when you say helping,
Providing education.
what does that mean?
So we do individual education. So during one of our appointments, they're either sitting down with one of our nutrition professionals or with one of our registered dietitians to talk about, what and how they're feeding their kids or how they're eating during their pregnancy. So it's nutrition counseling.
I imagine infants, women, probably breastfeeding education is part of that too. Is that a big part of that?
Yeah, we do a lot of breastfeeding education and support. We have highly trained breastfeeding specialists on staff, including a lactation consultant. So give a lot of what we call anticipatory guidance. So, education before you start breastfeeding, as well as some of the troubleshooting. Once you are breastfeeding, having challenges, we have staff that can help with whatever challenge you might be coming up to with breastfeeding. So, we have nutrition education, breastfeeding support. We're also well connected to medical and social services in the community. So another big part of WIC is referrals. So connecting our participants to whatever other resources they need, whether that be getting their well child check, getting their immunizations, getting like a developmental screening. So if parents are talking about some delays or concerns about how their child is developing, then we have those resources to get kiddos connected and evaluated and help they need.
Connecting the dots. I love it.
Exactly.
That's perfect. Keeping everybody together. That sounds like what WIC does. How big is the need in Deschutes County? Is this something that, just massive? I don't have any idea of the scope.
Yeah.
So maybe you can explain a little bit, and because people might not either A, know about the program, or B, know that this is really a need for people. Yeah.
So in Deschutes County, we serve a quarter of the infants that are born. So 1 in 4 infants are participating in WIC in Deschutes County.
Okay.
Yeah, so it's pretty high.
That's pretty big.
Yeah. Last year we served just under 5,000 individuals. And
that seems like a big number too, Christine.
Yeah. There's a lot of people that
5,000, okay.
Mm-hmm. And we're serving about 60% of the eligible population in our county. So, or a little around there. But for the first time in decades, we're seeing an increase in participation. This is kind of a new time for us to be, every month we have more and more people that are
wanting it,
needing it. Yeah.
Well, I was going to ask, I imagine this program, federal program, so big at the nationwide level. Mm-hmm. It also comes down to the state level, right? Mm-hmm. And then down to a county level. So I imagine that this has a big impact on our community. So, but what kind of successes are you seeing, and how do you measure that success? Obviously you're seeing the growth. Mm-hmm. That's obviously a good indicator. But what are people telling you about this program and the impact that it's having on them and their families?
Yeah, I think one of the biggest impacts, on the individual level for those that are participating is having that security that they can feed their family month to month. Food budgets are getting tighter. Families' budgets in general are getting tighter. And knowing that they have WIC to be able to, stock their pantry and put food on the table for their kiddos. And that, I think, is one of the things that families are seeing as the biggest benefit of WIC.
Well, having food's important. I imagine the partnerships then are crucial, right? With like neighbor impact and things like that in order to, how does that collaboration work?
Yeah, our partnerships are really important because like neighbor impact, so they run Head Start and Early Head Start, and those kiddos almost all of them are eligible for WIC. And so Neighbor Impact is a really big partner that gets kiddos connected to WIC if they're not already enrolled. So that's really helpful of just having partners aware of our program and getting families connected when they're, seeing that families are struggling or have a need. Yeah.
Do people come back to you like, I know you've been in the county a couple of years, so maybe not a ton yet, but maybe they've come back and been like, and my kid's a toddler now, or kindergarten, whatever, coming back and be like, man, thank you for WIC. I really appreciate it. I had no idea how much I needed that, and now look where we are.
Yeah,
Do you
absolutely.
see that?
Oh, yes. Yeah. Like generationally, too, where
Really?
it's like, grandma's coming in with, her daughter who's now pregnant. And like, I remember when I had WIC.
Oh, that's cool.
Yeah. Oh. It's one of our, like, best referral sources are, like, grandma or mom.
Oh, okay.
Letting their, now adult child who's starting their own family and be like, yeah, WIC is available to you. So that's pretty cool. We also have several staff, or just WIC nationally, where it's WIC participants who become WIC staff, which I think is pretty cool to have that like lived experience of our staff and staff that really find value and think the program is so important that they want to make that their career.
That's pretty cool. Yeah. How does somebody get started? So is there an application process? What do people do in order to get going on this thing?
Yeah, so to get started, they can go to our website, the Deschutes County website, and there's a referral form, so they can fill out a contact form, and we'll contact them and get them an appointment. So to get enrolled, we do have to do an appointment, make sure you're eligible. So maybe we should talk about like who's eligible.
Sure, yeah. Tell me.
I feel like that's probably a pretty important piece.
Because I don't know.
Yeah, so I mean,
women, infants, and children.
Women, infants, and children.
You're
Seems pretty obvious. I wish it was all women, infants, and children. Everyone needs a little bit of help with nutrition and breastfeeding. That'd be great. But so the population that we serve are pregnant women postpartum. So depending on if they're breastfeeding or how much they're breastfeeding, it could be 6 months to a year that they're eligible. And then kiddos up to their 5th birthday.
Okay.
So they need to be in that category, eligibility category, and then they also need to be income eligible. So a real easy way to know if someone's income eligible is if they're getting OHP, SNAP, or TANF, then they're automatically income eligible for WIC. If they're not participating in one of those other programs, then there's income guidelines. It's like 185% of the federal poverty level to be qualified for WIC. So you got to be income eligible. They got to be in one of those women, infants, children category. And then for Deschutes County, I say they have to live in Deschutes County-ish to be eligible for getting services from Deschutes County. I say ish because we do have participants that will serve from Jefferson County or Crook or Klamath that, they're coming to Bend already, or they're, coming into Deschutes County and they choose to get services from us. So we can serve them. We're just not going to go set up shop in Crescent and offer services there.
Right.
So,
but you do have other locations besides Bend too, right?
Yeah. Oh, yeah. We got several locations. So we got a building in Bend. We serve people out of the health services building, but we also have a building in Redmond. We have a nice brand new building, public health building in Kingwood.
Kingwood.
Yeah.
244 or 236? I can't remember.
236 for public health.
236, okay.
Yeah, it's nice. And then we have a building that we work out of in La Pine. So we're down there once a week.
South County.
Mm-hmm. We're actually at the La Pine Community Center, which is right next to the high school.
Cool.
So not in the South County
sorry.
building.
I just meant South County generically. But yes, yeah.
Okay.
Yeah, not the South County building, which is at the tail end of La Pine.
Yeah.
Right as you're leaving.
Not there.
Not that one. High school.
Right next to the high school.
By the high school.
Exactly.
Thanks for explaining.
Yeah. And then we go to Sisters once a month. We have...
Me too. No, I'm just kidding.
There's so much to do there.
I know.
There's an apartment complex that we do a clinic out of the community room.
That's
Ponderosa
cool.
Heights. Yeah, it's fun.
Right on.
And then we also go to Terrebonne. So public health got a van.
Yes, a new van.
Yeah, you heard about it.
Oh, I've
You've seen it. You've taken pictures of it.
Took some photos of it.
It's beautiful. Yeah. So we take it.
Photos are great.
You did a great job.
No.
Yeah, didn't you
It's a
get
van.
some
It's a van.
nice
van.
clouds in the pit back too?
The fact that you know that is okay. All right. Yeah, there was some clouds, and Holly Milligan was great. She helped me. She cleaned the van, got it all set up, and then all of a sudden, just this sunset right on top of the van. I mean, yeah.
It was beautiful. You did a great job.
I appreciate that. Thank you. It's very kind. WIC.
So we take the van down to
You take the
Terrebonne
van.
every
Okay.
month. Yeah, we go to the elementary school parking lot. We set up shop there and have a clinic. And
So when people come in, I mean, kind of walk me through it. So, okay, they apply, and then they go through you kind of do this little screening process, make sure. Then I imagine there's an initial meeting, and then what? What kind of, so people, I'm asking because I'm wondering if somebody's listening to this and might be interested, what are they going to go through? Is it meetings, or is it is it a bunch of people in a room? Is it, are you doing hands-on training? I don't know. So I'm wondering if you can tell me.
yeah, great question. So in the initial enrollment appointment, we're going to do a growth assessment. So we'll check height and weight. We also do a blood test, check iron, and then provide nutrition education or breastfeeding support, whatever the client is interested in. So that's the first appointment. And then a typical enrollment period or certification period is a year. So in the middle of that certification period, we're going to do another appointment in person or over the phone, where we do growth assessment, nutrition education, breastfeeding support, referrals, and that's going to be an individual appointment with one of our nutrition counselors. So we have those 2 appointments that you'll complete, and there will be then an additional 2 what we call nutrition contacts, and those can be an online class, or it can be seeing the dental provider. So we have Advantage Dental come in and do health screenings and nutrition education around how to have healthy teeth and how to support healthy teeth with your diet. So you could see the dental provider from Advantage Dental as one of your nutrition contacts. So within a year, you'll have 4 contacts with us, but they can be by phone, which is kind of nice. Oh. So it used to be that WIC everything was in person. We'd do group classes, and but now with COVID, we got some waivers. USDA said, "Oh, this works well for families to let them do things by phone and do things remotely." Who knew?
Well, I was curious because I obviously haven't been through this program at all, but just didn't know if it was like a classroom setting and, you're doing the outreach that way, if there's hands-on. It sounds like it's kind of maybe a little mixture.
Yeah,
Okay.
yeah. There is a mixture.
How big is your team?
There is 10 of us.
Okay.
I think that's the right count.
10. All right.
We'll go with 10.
Yeah.
Yeah. We got 2 dietitians, and then we got 4 nutrition counselors. And then we got 4 front desk staff, admins that
There you
support
go.
the program. Yeah.
There you go. Well, you got the health fair next week. 50 years.
50 years.
50 years. This all started in Kentucky. Do you know where in Kentucky?
Prineville, Kentucky.
What?
Yeah.
It is not Prineville.
It is.
You're making that up.
Now I'm second guessing myself, but I'm pretty positive it's Prineville, Kentucky.
Wow.
It's like this little town in Kentucky.
We're like a sister city. When we go Prineville next. Okay. It's not Deschutes County, but okay. Well, besides the health fair next week, June 6th, 2:00 at the Courtney Building. Is there anything else exciting that's going on about your programs? Anything on the horizon that you're just like, oh man, I can't wait for this? Crickets. Where's my
this is maybe.
Can I get the crickets sound effect? We need the cricket sound. I don't have one. I don't have a sound. Oh, we got crickets.
You just have that on the ready. That's
on
one
the-
of your
just on-
4 main buttons.
I don't know. You didn't answer quick enough. Crickets came to mind.
Well, okay, so one of the things that I'm excited about is that the USDA just passed this new rule about the food, what we call the food package, so the foods that we're able to offer from WIC. And with that new rule, it has secured that we can offer more dollars for fruits and vegetables.
Oh, that's cool.
And as a dietitian, I'm like, yes, more fruits and vegetables. Everyone needs more fruits and vegetables. So I'm super excited about this new food rule that's coming. That I think Oregon has 2 years to implement it. So, 2 years out, but that's still a short timeline for a program that's been around for 50 years. So, I'm excited about those changes that are coming. But I'm still pretty excited about 50 years of WIC.
50 years of WIC is great.
Yeah.
It's not often it's 50 years of anything.
50 years of a federal program,
Yeah.
right?
Oh, that's great.
Yeah. I don't know.
And we're partying.
We're partying.
All right. So what booth do I need to go to at this health fair?
We're gonna have
who's the fun group is basically what I'm saying.
selfie booth.
Okay.
But OXU Extension is always fun because they do food demos.
They do have fun people. Mm-hmm. Yeah.
Always something
right.
tasty. They got they're whipping up. So
I'll be there with my camera. So if you can, get some nice fancy clouds or something for me, it'd be great.
can you make sure it's not smoky?
Do
you have any control over that?
Nope.
I'm glad that it cleared up this afternoon, though.
Yeah.
This morning was...
Yeah, it's been a little smoky. At least at the time we're recording, it's been a little smoky.
Yeah.
Well, fun stuff, Christine. Lots going on.
Indeed.
Thank you for explaining. I didn't know a lot of that stuff. Certainly didn't know this started in Kentucky in Prineville. If it's you're frantically looking
Checking my notes here.
We're going to get a wiki page for WIC. Is there a MIC? Is there a MIC?
What are you talking about? A
Is there
MIC?
Men, infants, and children?
No, but if we help fathers that have children.
Well, I guess that's a fair. I was kind of kidding, but it's kind of a real question too. I'm a guy, and so how do you serve the single dads out there?
Yeah, so
Or
as
do
long
you?
as we absolutely do. As long as their kiddo is under 5 and income eligible, then their kid's eligible. Dad
Done.
can bring them in. Foster parent
done.
can bring them in.
We're starting a MIC.
Or grandparents that are the primary caregiver. We got a lot of grandparents that are taking care of their grandkids.
Well, there's a lot of situations out there, right?
Yeah,
So
yeah.
that's kind of the reason for the question.
Yeah, you don't
So-
have to be a woman to...
We welcome them.
Participate.
We welcome them all.
Yes,
All right.
indeed.
Christine Pagano, supervisor for women, infants, and children.
That's correct.
Thanks for being here.
Thanks for having me.
If you want to find out more about the WIC 50th Anniversary Health Fair, there's information on the Deschutes County WIC and Deschutes County Health Services Facebook pages. That's Thursday, June 6th from 2 to 4 p.m. at the Health Services Building on Courtney. If you want to apply or learn more about the WIC program in general, just go to their page at Deschutes.org. Lots of good information there. And a reminder, you can listen to us wherever you listen to your podcasts, or you can find us at Deschutes.org/podcast. But until next time, be safe out there.